Most people think about heart disease as being all about cholesterol, but here's the truth. Half of all heart attacks happen when people have normal cholesterol. And I've seen clients with very high cholesterol, yet they have zero atherosclerosis on a CT angiogram. So what's going on here? There are a number of factors going on, but one of the biggest is inflammation and the damage that can cause to the arterial wall. And it's the missing piece in almost every standard blood test. In this video, we're going to look at the specific inflammation markers that tell us when your arteries are under stress, long before plaque or symptoms may appear. Inflammation isn't always bad. It's how your body heals from that inflammation or injury. It's why I always recommend not doing a blood test the day after a big strength training exercise or cardiovascular exercise, as that can temporarily spike some of the inflammation markers. But we are mainly focused on chronic inflammation. When it becomes chronic, that same defense system turns destructive, damaging the delicate lining of your arteries. That's why the cardiozoomer includes a full inflammation panel, destabilizing plaque and accelerating cardiovascular disease. These are the markers that your doctor probably doesn't check, but they reveal far more about your true heart risk than the standard cholesterol tests. Let's have a look at some of these key inflammation markers that can help to identify if you have chronic inflammation or not. The first is hs-CRP, or high sensitive C-reactive protein. It's the simplest, most validated inflammation marker we have. When hs-CRP is high, it means your arteries are inflamed, even if your cholesterol looks normal. And there are multiple large studies, including the Jupiter trial, that have shown that people with elevated hs-CRP are 2 to 3 times more likely to have a heart attack. And that hs-CRP is a stronger predictor of cardiovascular disease than LDL alone. So when both LDL and CRP are high, that combination increases your risk. Because you've got the raw material for plaque and the inflammation that makes it unstable, ideally you want your hs-CRP under 1, and it's lower the better. Between 1 and 3 gives you a moderate risk, and over 3 definitely increases your risk of heart disease. hs-CRP is something your doctor can test, but often does not. The next few inflammation markers are part of the cardiozoomer test, and they are not tested as part of a standard blood test. Next is interleukin-6, or IL-6. Think of IL-6 as the alarm bell for inflammation. It tells your liver to make CRP in the first place, and when both IL-6 and CRP are high, it signals that there's a deeper inflammatory process going on, often driven by things like visceral fat, infections, or chronic stress. TNF-Alpha is another cytokine that keeps the fire burning. It's produced by immune cells and fat tissue, and it's strongly linked to insulin resistance and endothelial damage. When TNF-alpha is high, it can raise blood pressure, increase oxidized LDL, and accelerate that plaque formation. Now we're going to talk about homocysteine. This one's different. It's not an immune marker, but a metabolic one. High homocysteine damages the endothelium, the smooth inner lining of your arteries. It's often elevated when your body lacks enough folate, B12, B6, or B2 to recycle methyl groups efficiently. It's what we call poor methylation. It can be connected to mutations in genes like the MTHFR, but not always. Testing and optimizing this marker is one of the easiest things to do to reduce your cardiovascular risk. Homocysteine was one inflammation marker that was elevated with me. Now the levels are under control, but it could have been a contributor to my personal heart disease story, which I'll discuss in an upcoming video. Next up, we have MPO, or myeloperoxidase, and it comes directly from the white blood cells. When they attack cholesterol particles inside artery walls, MPO levels will spike, and that means active oxidative stress, or oxidative inflammation. The type makes plaque soft and unstable, so if MPO is elevated, it tells us there's an active plaque formation happening now. And if it's chronic, that makes it worse. And finally, we have Lp-PLA2, or plaque. This enzyme sits right in the arterial wall, and it's trying to clean up the oxidized LDL. It's like the smoke detector. When it's high, you know there's a fire somewhere. It's indicating high levels of oxidized LDL. And especially of high CRP, it's one of the strongest predictors of potential plaque rupture and stroke. Each of these markers tells a different story. IL-6 and tumor necrosis factors show early immune activation. CRP reflects systemic inflammation. MPO and Lp-PLA2 reveal inflammation inside the arteries, and homocysteine connects metabolic stress to your vascular damage. When we combine all of this, we get an overall view of your inflammation. Inflammation is how atherosclerosis starts, and this shows how active it is and how it's affecting you. So here's the takeaway. Cholesterol alone doesn't tell the full story. It's inflammation that's driving the damage that turns normal cholesterol into potentially dangerous plaque. And so if your doctor's only checking lipids, you might be missing one of the biggest predictors of heart disease. The cardiozuma test from Vibrant Wellness brings all of these inflammation markers and a whole lot more together so we can get the big picture of your cardiovascular risk. And if you want to find out more about the cardiozuma test, the other markers that it checks for, watch my full cardiozuma walkthrough on this video next. And I'll put the links to the cardiozuma test in the description below. If you have any questions or comments, you can leave a comment below.